doing a room scan. Okay. So I'm knocking on the patient door. Hand hygiene. Introducing myself. Hi, Mrs. List. My name is David. I'm your Harper College nursing student for today. So here I'm just assessing your thorax and your lungs. So I'm just going to ask you a couple questions. Have you ever smoked before?
No.
Okay. Do you have anything like asthma? No breathing problems
No.
like that?
No.
Okay, great. So first I'm assessing my patient's respirations. I see that my patient is having regular breaths, and their breaths are deep. And if I counted for a minute, my patient has 18 breaths per minute, which is normal. I'm also checking to see how my patient's position. So my patient is sitting up straight, and they are having deep breaths. They're not showing any signs of wheezing or anything like that. And then after that, I'm also going to check for any retractions or bulging in the inner spaces, and I'm seeing that everything looks fine. I'm also checking the posterior chest, and there's no abnormalities in there as well. My patient isn't using any accessory muscles. They're sitting up straight and breathing just fine. I'm also noticing that the symmetry of the chest is also regular. I'm seeing that the anterior-posterior ratio to the transverse ratio is 2:1, which is normal. And then I'm also checking the skin to see if there is any pallor or cyanosis, and it doesn't look like it. So far the inspection is normal. And then I'm going to begin with palpating the chest wall. So I'm looking for any abnormalities, any bruises, any lumps or bumps, anything like that. So this all looks normal here. I'm not feeling any abnormalities. I'm not seeing any abnormalities. Okay, good. And then after I palpate for any abnormalities, there's no lumps, anything like that, and I was touching the skin. The skin is a warm temperature, and there is no cyanosis or signs of pallor. I'm now going to look at the chest expansion. So I'm going to bring my thumbs in the back here, and I'm going to check for the chest expansion. So I'm going to have the patient take a big breath. And I can see that my two hands are moving in and out. One more time. So the chest expansion is normal. So I'm going to ask my patient to come back. So after that, I'm going to go ahead and auscultate the patient. So I'm going to first begin with the anterior part of the thorax. And then you're going to take a big breath in and out through your mouth. Okay. And that is normal to me. So now I'm going to go ahead and palpate the posterior chest, or the anterior chest. Side to side. Big breath in. And I'm going to listen to each breath side to side. Okay. And then right here. Return. Okay, and all of the breath sounds are clear and normal. I don't hear any crackles or anything like that. So now I'm going to auscultate the right side of the patient's lungs. So I'm going to auscultate 3 locations. So, big breath. Okay, so that's clear. Now I'm going to come to the left side, auscultating 2 parts. Okay, and then now I'm going to go ahead and auscultate the posterior side of my patient's chest as well. So I'm going to start from up top here. And I'm waiting for each breath. And I'm going in between the scapula, as close to the spine as possible. Okay, and all the breath sounds are clear. My laptop came off. Okay, and all the breath sounds are clear. So after I have auscultated, the I made sure that the bronchial sounds were clear, which was by the thorax. I made sure that the bronchiovesicular sounds were clear, which was in the middle of the chest, or by the scapula, by the sternum. And then the vesicular sounds were also clear, which was by the transverse side. So after I've completed that, I am all done with the assessment. So thank you for watching. And if you need anything else, go ahead and please call the call light, okay?
Thank you.
Thank you.